So the question comes up quite a lot, like therapy. Okay, is it in-help, in-person, or is it going to be self-help books? I'm going to get to that in a question, but first, I want to kind of just spill a bit of a caveat to you guys and also a chestnut. Now, before we're going to get into the caveats, I'm going to get into this little story. When I was an undergrad student, I was enrolled in a class. It was microeconomics, and we had a very funky professor. He was quite jovial, good with his term, good with his explanations, but there was a bit of a shortcoming in this. And I wasn't an in-person student. I wasn't enrolled in the class. I couldn't sit the class like all the other students because that class wasn't given in that specific campus that I was at. So the campus was a couple hundred miles from where I was actually living, and I wasn't enrolled in the class, but I was an online student. I was extramural enrolled, which meant I had access to all the online lesson plans, the curriculum, the textbooks that everybody else consulted. But there was one massive problem in this course. I couldn't consult the professor in person, meaning that whilst he was giving his lesson plans, I wasn't present. The lessons that I had access to were rather older lessons, and I couldn't actually. Sometimes he wouldn't even answer the emails because he was far too busy and just far too overfluxed to actually answer the emails. So I had to do everything by myself. Also, actually accessing the Facebook groups were rather tedious, not least because all the students were already, I mean, it was faster for them to actually get the help they needed. So the trade of answers and questions I was on the receiving end of that. So lo and behold, I couldn't actually get to more help if I really needed it. Now, the interesting part of that the statistic was this professor said in the start of the lesson, the prelude, he basically attested to the fact that he did a couple studies, like he jammed it a kind of couple times, where I think about 3 or 4 times he did the study, and he found that the students who were enrolled online, meaning my group, the people who were enrolled in like 10% of the specific campus holders, were doing better in both the end exam, but also better in the internal assessments than the in-person students who were enrolled. 90% of students were enrolled in person. Now, no, I know what you're thinking. We didn't get extra help. We didn't get extra aid from the professor. We didn't get any type of other resources because we were alone. What's interesting is that what the reason that he gave was that the people enrolled online were more motivated, more tenacious, more going for the material than the people in person because there was a bias. You see, the students who were enrolled in campus, there was a lot more diversions. There was a lot more distractions amongst these students. They thought they had a bit of a confirmation bias of confidence that they could do better because they got the help of the professor and we didn't. So it's just an interesting stat that the students who were enrolled in person didn't perform as well. And I have a reason or an explanation for exactly why I think this is the case. But this situation reflects what you would get with self-help. And this is why I think it's such an interesting conversation to actually get into and to essentially reference when it comes to self-help versus in-person therapy. Now, my own experience was that self-help is actually superior. And I'm going to get into that in a second. Firstly, the biggest problem that I found with the question, the type of person who asked the question, is self-help superior or is in-person therapy superior? Is the wrong type of person because such a person is already distrusting the benefits and the meat of self-help. Now, self-help to me is a very collapsist term. It's a very euphemistical term, very hedged onto this idea that you can actually find the solutions yourself. And the type of term self-help is a bit of short of what in law of what it can actually offer you. Self help can be very vast, self help can be very entertaining and extremely in depth um, to the actual query, which in this case is OCD and solving OCD's problem. In self help, I don't believe that the label. I think it's a bit of a double speak. I don't think that the label really serves its right when it comes to the informative part of self help. Now, self help can mean you skim through a text manual, or self help can mean that you go in really in depth. Either way, it depends on the person, and it really depends on the type of person that actually does endeavor and actually goes the voyage of getting better in terms of their OCD. Now, there's a lot of material online, offline, people you can talk to, etc., etc. But more so, there's a lot of things in the self-help community that are referenced that are based on authority. For instance, if you go in the IOCDF, there are a couple textbooks that we know are being, they're being used by clinicians. and the clinicians are actually referencing the material in these books. They're actually learning from the books themselves. So it pays into question, what is the efficacy of self-help? But an interesting thing I want to just reveal is that there's another study that shows that the two compared side by side, self-help and in-person therapy are equals, meaning that if you do self-help or whether you're doing self-help or in-person therapy, the results and the outcomes will be correlatively the same. The problem, though, is that in a lots of self-help and in-person therapy, the types of people aren't selected, so we don't know the type of person, how intellectually gifted they are to understand information. I mean it obviously quite spuriously here, or the type of therapist that they've consulted. For instance, if you have a very shit therapist, and I mean somebody who's politicking, somebody who's actually just chatting to you, that's going to count as therapy, quote unquote, but you're not going to really get much out of that therapy session, of course. However, if you consult a textbook like a clinician's manual, the prime or the gold standard of self-help textbooks, the actual clinician's manual, now obviously you're going to be getting the evidence-based methods that hitherto have been used in OCD. So obviously you have the latest updates, the latest and greatest of whatever they've been using in therapy. It's also interesting to know that therapy has a specific set. For the session by session, there's an outline. Usually in the first session, the therapist gets to know you, identify your trigger points. They use a sheet that's already known pretty much across OCD, and it doesn't really take a therapist to really do it with you. So I think you have to kind of deflect on what's needed with what's the type of work you need to do with the therapist versus what you can do alone. And if you actually do the research, you realize that self-help offers you everything that you need to get better. It offers you the mindset, which is really not difficult to understand. For instance, you gotta get used to uncertainty. That's number one. Number two, you gotta have to have your hierarchy of fear. So none of these things are actually codable by a therapist. You can do it yourself. You have to do it yourself. And after all, I mean, in terms of therapy, you are actually learning how to become your own therapist. So any therapist that is worth their meat teaches their clients to become their own therapists anyway. And this is interesting with the self-help. You are immediately stepping into the area of becoming your own therapist. And this is partly why I think that self-help is a much more platinum package that you can get versus the gold package or the silver package that you can get with in-person therapy help, is that it takes so much longer to progress. And the thing is that the session wise, I do think it's also to do with in-person therapy. We got to understand that, if you're going to go after, OCD specialists, you are obviously going to do some private funding. So obviously this is privately funded. You're going to be spending a lot of your pocket money in-person therapy. And there's a lot of incentive for somebody to charge you for, let's say, 10 to 20 sessions to do. And many of these therapists actually promise you that you have to stick with them for a year before you get, better. And I think that's a massive problem, because it doesn't have to take a year before you can get better. It can take 3 months for you to get to your crane of betterment. And so I do think there's a lot of profiteering when it comes to when it actually comes to in-person therapy that you don't really get with self-help. So in-person therapy is a bit of a double-edged sword, because I do think in one area you can get the prime really good, just an absolute artisan therapist who just knows what they're doing, they're understanding their work, and they can deliver it in such a manner that you can bond with that person, right? So that's a good therapist relationship, and you'll get quite a lot out of that. But there's also the caveat to it, and that is you can get a bad therapist and you won't really know. Yes, you can go by ratings, but it's really difficult to tell. Might just fall out with this one therapist, and it's then difficult to actually progress to any higher echelon from where you are right now. So I think it's important sequentially to try and get to why therapy might be better than self-help. And I think the one answer to this would be if someone cannot study as well. For instance, a person who's not able to actually study and get to the help they actually need and get to the evidence-based therapies or methods will need the help of someone to guide them through that. It makes complete sense. But it's very difficult, though, to believe the converse to this. If you are somebody who can study, you are somebody who gets the right textbooks and stuff, I don't think there's anything more than someone can offer you in therapy other than just listening to you. And that's also, if you actually look at it in context, there's a lot of help available online that doesn't require therapists. For instance, you can go to Reddit, you can speak to other people who've been through therapy, and these people can offer you a lot of great tips, especially people who have suffered like you did, or with your specific ailment or your pathology. So, I mean, the whole premise that you that only a therapist is needed to ensure that you're going to get better is very questionable and extremely biased, because it's very clear that help is something that's extremely versed, and it's also very holistically based. So it's not clear, you know, if we're saying we need help, we need the right help. That help can sometimes come from other people who are not trained. So sometimes I believe that that's an important facet in getting better, is having a community, and a therapist might provide the community aspect of it, but I don't think therapy alone is what you will get from a therapist. I think that's something you can totally get and depend on from self-help. I mean, everything is pretty much out there. Like, what works is already publicized. We already know what works. Already understand, like in OCD, the idea of the hierarchy of fears you're going to be making. You understand that's important, and a therapist would ask you to do it anyways yourself to determine exactly what is the triggering fear. So these are the work that you would actually do by yourself without needing somebody else, an extra party. And that goes back to you. It goes back to you as the person, the sufferer, to find out exactly what you're suffering from and how to actually encapsulate the solution. So everything in the end of therapy goes back to you. The tools are given to you, and you have to kind of figure out how to gel with them. And many therapists, of course, will tell you that everybody's unique. So doesn't this just beg the question that you can find the solutions yourself anyways through textbooks or through clinician manuals or any other mediums? And then I would say yes, of course, because clinician manuals are unbiased. There's no sense of profiteering in a clinician, or very little. Of course, there's going to be a sense of profiteering in it, but I believe that the reason that self-help books are that therapists, or the writers or the authors of self-help books, do not really think about profits as much, is because the margin of profit is much larger. I mean, if you can sell a self-help book, let's say, and you price it at $15 for one book, and you can sell it at, let's say, hundreds of thousands of people, I mean, just multiply that, and you get, you obviously get a lot more money than you would get from, let's say, prescribing one session for one client. And I know this is a bad example, but if your book really sells, it's going to be a bigger hit. If you actually revert to stuff that works for the average person, it's going to be a bigger hit, and you're going to get a good rating from the book, and you're going to be able to get a lot of recession from that specific book. So, of course, it makes sense for someone to write a book, and of course, you're divided between two paths. Are you going to do the book route, or are you going to I'm not going to tell you exactly how and why people decide to do sessions versus books, but I think there's very good evidence to suggest that self-help already prescribe what you need to get better. And my own take in it is that when I actually done the work, especially when I got through courses, video courses were very, very attractive and sexy looking, I found that the books were actually far better and were more comprehensive. And then I realized that maybe an in-person therapy is going to be even less comprehensive than that. They're just going to stretch it out. And lo and behold, I actually chatted to people and found out exactly that. That quite a lot of people, I mean, anecdotally on Reddit would say they've benefited a lot better from books, and everything is already out there. So I would say that, well, self-help, if you are somebody who cares about studying, pays attention to yourself, pays attention to what's out there, I would say self-help can be the answer for you. There's a lot of information out there. Everything that works already out there. You can teach yourself how to become your own therapist. You know yourself better than anybody would ever know yourself anywhere. And you're better off joining a community of people. If you really have questions, ask other people who suffer from your condition or other conditions, ask them what helped them. They will reveal to you. That's better than any therapist will give you. With a therapist, you work on one person. You can go out there on Reddit, or you can go there on YouTube, find other people suffer and actually ask them directly. And you have a lot of other people to actually request and to learn from. You have a community of people. It's, in lieu of actually looking at one person's advice. So I think there really is a lot of information out there that you can actually benefit from. And there's a lot of reason for believing that self-help is superior to therapy. And I'm a massive advocate. I'm a massive affirmative to that. I would say self-help can be absolutely a replacement of therapy. You know, given that you are actually researching the right thing, given that you have the right mindset, that you get the right books that are evidence-based and authoritative, I believe that you are on the right path when you're going to go the self-help route. Anyways, bye.